We made a revision yesterday on the mechanism of labor, so let me try to know if I can remember it. Now, this is our pelvis, our maternal pelvis, and this is going to be our baby. Although it looks a bit smaller, but we're going to use it. Now, what is the mechanism of labor? Mechanism of labor is a series of events where the baby negotiates with the birth canal. It has 7 prerequisites. The lie has to be longitudinal, the denominator has to be the occiput, the presentation vertex, presenting part has to be the posterior part of the left parietal bone, presenting diameter occipitofrontal of 10 cm, and the engaging diameter suboccipitobregmatic of 9.5 cm. At the onset of labor, the head engages with the sagittal suture. The sagittal suture is the suture that connects the 2 parietal bones, so it engages with the sagittal suture. It's the occiput facing the left iliopectineal eminence and the sinciput facing the sacroiliac joint. Now, with good uterine contraction, adipose pelvis and a normal-sized baby, descent takes place. When this descent takes place, it makes the occiput to become the leading part. The occiput, being the leading part, meets the resistance on the pelvic floor due to the contraction. When it meets the resistance on the pelvic floor, it turns 1/8 of a circle along the left towards the right. The occiput now comes under the symphysis pubis, and the sincipus face and chin faces the hollow of the sacrum. Are you seeing it? Faces the hollow of the sacrum. Now, with further descent, the occiput and the biparietal bone escapes the symphysis pubis, and the sincipus face and chin sweeps the perineum, and the head is born in extension in the absence of contraction. Now, moving further, with further descent, the anterior shoulder faces the left iliopectineal eminence, and the posterior shoulder faces the right sacroiliac joint. The head turns a bit to undo the twist on the neck to align with the back, right? So as this is happening, the anterior shoulder will now come under the symphysis pubis, and the posterior shoulder will now be in the hollow, will now face the hollow of the sacrum. Remember, as the head is trying to undo the twist, it is called external rotation. And as external rotation is happening, internal rotation of those shoulders is also happening. Now, the anterior shoulder under the symphysis pubis escapes, and the posterior shoulder sweeps the perineum. Are you following me? And the baby is born in lateral flexion to the mother's abdomen, right? This is the mechanism of labor. If there is any step I forgot to mention in this video, do also drop it in the comment section. And bye guys, see you on my next video.